Hello again, everyone. Dr. Dan Bockmann here. Today, I want to talk about pain thresholds. So, I hear this a lot from patients. Surprising amount. I hear about, I'll ask them, I'll say, hey, how much does this thing hurt? You know, either this bend or this movement or this stretch or me pressing on this spot. And they'll say, well, it's a little sore, but I have a high pain threshold. Now, what they mean, what I believe they mean when they say that, is that, yes, I can feel some soreness there, but I believe that I don't feel pain as much as other people feel pain. So therefore, what you're doing right here on someone else might be excruciating to them. And yet it's not for me. And they're worried that they may be missing, they may not be feeling the pain as much as they should be, and they worry that they might hurt themselves going through life, for example, because they can't feel pain. Now, a couple things about that. Number one, it is possible to have a reduced capacity to feel pain. So, I mean, there are a couple of neurologic diseases that would make that possible. I mean, multiple sclerosis or diabetes can give you peripheral neuropathies that make it less likely to feel things. But in the absence of those, or nerve damage or something like that, what I tell patients is the only pain that matters is the pain you can feel. And if it's not excruciating, it's not excruciating, full stop. Secondly, it's really hard to compare my pain to your pain to her pain, because what are you going to measure it with? So all pain is described in a subjective way for the most part, and there may be some specialized, high-tech tests you can do, but still they're just kind of guesstimates, they're educated guesses. So if you've ever told anyone you have a high pain threshold, I would ask you why you think that. And also, I'll tell you not to worry about it, because it doesn't mean you're at any greater risk of accidentally doing damage to yourself because you didn't feel the pain that would have warned you off from that thing. But I'll also remind you that the only pain that matters is the pain you can feel, and the amount of it, how severe it feels to you, is the important thing, not how it might compare to someone else's pain. Now, I suspect that the reason most people believe this to be true is if they had an injury and they went to see a doctor, let's say, maybe they had an x-ray, maybe they had a broken foot or something like that, and the doctor or someone else on the staff expressed amazement, hey, how were you able to walk in here with a broken foot, for example? And then they were amazed that you handled that pain as well as you did, which would then suggest that you may not be feeling it or perceiving the pain as much as someone else with a broken foot. So I understand where that comes from, but in reality, it kind of doesn't matter as a practical thing going through life. Whether your pain may be different, it's impossible to really measure anyway. So if you do, I would love to hear the reasons why you guys think that you have a high pain threshold. No shame here. I would love to hear. Leave them as comments down in the below the video, and I'd like to see if I'm right, because I'm just kind of guessing to this point. So anyway, hope that's interesting. If so, leave some comments about your pain threshold, and if you like this channel, subscribe, and I'd love to answer any future questions you have in videos. Thanks again. See y'all next time.